Firstly, I suppose I just wanted to say how positive the last couple of days has been. And it's been really good to catch up with our international colleagues, and I can't quite believe it's been a year really since we were last sat here sharing all the really good work. In terms of Hywel and the way forward, I suppose you've already heard from some of our services today. And in terms of the way forward for us, it's fair to say that we've have many positive opportunities really created via the network in terms of changing the way that we've historically delivered services. We're also really lucky to be given an opportunity to start discussions with Trieste Services around entering into a formal exchange contract following our recent visit, and now really is our chance to do better for and with our service users going forward. We're committed to changing the way that we deliver our services, and hot off the press last week we obtained our board approval to move forward with this work, which is really, really positive for us in starting to make some real change. The inspirations come from the many services we've experienced and heard about through the network, and from our service users' views of how we need to change things going forward. It's fair to say there are many challenges upon us in delivering statutory services, but I do strongly believe that the solutions lie in delivering our services together as partners. Our partnership board for the health board area is established, and the breadth of our partners is growing, which is really positive. And I think this provides us with a constructive forum and structure to develop our services further. And the co-production of our annual report this year, I think, is starting to demonstrate a change in our commitment to doing this together. The further development of the learning sets is a key priority for us in starting to change the culture within our services and our communities in the Hywel area. And embedding this approach within our practice is really essential in feeling the true impact of this approach. The Health Board, having signed the organisational pledge for Time to Change Wales campaign, are committed to tackling mental health stigma and discrimination within our workforce, our services and our communities. And we've recently had a week where we've done a number of events around the Health Board area in getting the public and our staff to sign their own personal pledges to how they are going to tackle mental health discrimination and stigma. We've got a really exciting time ahead in Hywel with our service users, our partners and our communities to make a real cultural change for our people. Okay. Thank you. I'll step down now.
Okay. This is usually too high for me. A bit down. I'm afraid to break it. Thank you. Okay, I mean, I'd like to echo lots of the things that Libby said, and I was thinking about the co-production of our Together for Mental Health report as well. That's really exciting. I'm looking at John at the back, because I know you've made a big contribution to that, and that's really good. I mean, these 2 days have been quite amazing in terms of the amount that we've had to take in and process. I mean, I've been quite overwhelmed. I found it actually quite difficult to process it all, especially hearing about the things close to home, but the things far away as well. It's been so good. As a clinical director, for ABMU, I've had a range of different emotions, I'm afraid. When I've heard about the ongoing work of the action learning sets, that they've been really good and they've made me feel proud. And then when I also had a sense of shame when I was listening to Sarah's description of how unwelcoming our service had been when she needed support. But I think what's really important is that Sarah found the courage and the strength to actually come up here and describe her experience, so that we have to use that as a catalyst to make more changes, to improve what we do. We're already in a time of great change. You know, the measure came and we had to change and adapt our service, and we're constantly trying to find more ways to help and support people where we don't take them away from where they live and their normal patterns of life. I mean, as a psychologist, I'm used to listening to things that are difficult and painful. That's my day job. And then work with somebody to help them and support them so that they improve the quality of their lives. And I actually see the role as a CD as that's the same. That's what I do. I listen to things that people describe, this is awful. And then I support a group of staff and the people themselves who are telling me, how do we make it differently? I don't actually do very much. I just listen and sort of make things happen. I'm saying that to Paul. I work hard, but I don't do much. And I think it's important we use this conference as a catalyst to actually, you know, give our change process more energy, because we are changing. But I think sometimes, I mean, I actually feel like I've been trying to close Kevin Coyd forever, and I'm probably looking at a lot of other people who feel the same. But what we need to do is to actually develop more acceptable and welcoming services to support people closer to their ordinary lives and not take them away from, you know, the life that they really do have to go back to. And I think today, I know we've already making connections. Lots of people that I work with are telling me that they've been talking, like, for example, to Benna, can we come and see what you're doing? So, and, you know, get the good ideas and learn from what's worked in other places. So that's my thoughts. So thank you.
Exceptionally brief, you'll be pleased. I think, like last year, we from our point of view, the network, we don't intend to just again leave, you know, this without doing something afterwards. And one of the things that we are committed to is obviously making this an annual conference. But I think we will change the format in terms of our experience and have much more workshops and much more, you know, detailed discussion about the wonderful things that we've heard that perhaps you didn't have a chance to ask questions and discuss further and see how it could be applied, you know, to your situation. So I think that's very important that we change the structure. I mean, if you agree and you want to, then we will, you know, we will do that type of thing, you know, in about a year's time. I also like very much to thank not only the speakers from the local areas, but the international people. A lot of them have gone, but we've already thanked them anyway. But also thank you for, you know, staying and actually listening and participating in sometimes, you know, what's been a long session. And we certainly had that today. And I think that that's a sign that really people want to bring about change. They want to learn new things and they want to develop differently. And that's, you know, these things come from us in terms of wanting to change. They don't come necessarily from policies and, you know, directives and strategies. They come from the people in terms of wanting to make change. And that's the important thing.